For some people I see, they get off of gluten within 3 months, their thyroid function completely normalizes without any thyroid hormone. Or I've had people with H. pylori infection that can cause thyroid disease. They get rid of that infection and their thyroid function normalizes. And these are success stories that we like to utilize. And, as clinicians, we can showcase and say, this was just one little trigger that we took away. But for most people, it's a lot more complicated.
Welcome to the Healthy Skin Show with Jennifer Fugo, where we're flipping everything you've been told about your chronic skin issues upside down and connecting you with alternative solutions your dermatologist never told you about.
Welcome back to episode number 23 of the Healthy Skin Show. Today, we're going to talk about the connection between thyroid function, more specifically low thyroid function, and skin rashes. It's an important topic and one that is not discussed often enough. And in fact, in my clinical practice, one of the lab panels that I always ask clients to get is a full thyroid panel. So we're going to talk about that today in our interview. But first, I'd like to answer a question that comes from a listener. And as you know, this is one of my favorite parts of the Healthy Skin Show, that we include your questions in our segments. That way, you're able to get answers not just from me, but also from our guests. And sometimes your question can be so impactful and important that I'll actually find a guest to do an entire episode on. So today's question comes from Melina.
My question is, why is it not okay to use the hydrocortisone creams and all that stuff? What are the negative effects that they have on our bodies or our skin?
Melina, I want to thank you so much for submitting this question. The answer to your question is one that is both a bit more complicated than our time constraints allow for. So I'm going to give you the general overview. And then if you want to go and look more in depth about this, I actually wrote an entire article on skinterrupt.com that talks all about the ins and outs of why this isn't necessarily the best idea and why you want to be responsible if you are using topical steroids. I'll include the link to that article in the show notes for this episode. Before I give you the quick overview, though, I want you to know that whether you choose to include topical steroids in your regimen or not is a decision that you have to make with your doctor. It's also one that has to be based off of your own personal health values. It's not for me or anyone else to judge whether you are a quote unquote good or bad person because you choose to use topical steroids as part of your regimen. What matters more is if you do decide to include them, that you use them responsibly. That means knowing how long in duration you should be using the topical steroids. So you use them and then go off of them, use them and go off of them at very specific intervals. And you don't over apply them to your skin when you are using them. Your doctor should be able to advise you on the appropriate way to use them to help you avoid triggering the following issues. So the first is called red burning skin syndrome, or topical steroid addiction, or topical steroid withdrawal. And this is basically where your skin becomes addicted to the steroids. And as a result, when you overuse them and use too much and for too long of a period of time, it's almost as if it can't be without them. And it will cause what may be a smaller contained rashed area to end up all over your body. And you can end up taking about a year for this entire issue to go away. Symptoms can include redness that spreads to places where you aren't even using the steroid cream, persistent itching, stinging, flaky skin, swelling, nodules or skin lesions, fever, fatigue, other signs of infection, dry, itchy, sensitive eyes, increased sensitive skin, and even anxiety and depression because of the chronic pain of what's going on with your skin. So it creates this hypersensitivity across the body, which is really painful. You can also have thinning of the skin, which is something you should consider as pretty significant since our skin naturally thins with age. And so you don't want to be causing your skin to end up so thin that it will just break or easily tear. There's also an issue that it can cause red or purple spider veins, which obviously aren't necessarily harmful, but they're just for most people considered unattractive, as well as skin discoloration and scarring. The last point, and the reason why, is even though you're slathering these topical steroids on your skin directly, they can impact your adrenal health and in some respects suppress adrenal function. I'm not saying this to be alarmist. The effects are more pronounced in children and babies from the research that I've done, but it is something that we should be aware of, that you are putting something on your skin and it is being absorbed in, and it will have a global impact in other areas. So that's more or less the issue with why people have such a concern at times in using steroid creams and why there are people out there who are very against the use of them. That said, when I was dealing with my eczema on my hands, I did choose to use topical steroids sparingly to help keep the inflammation and symptoms knocked down while I was doing more quote unquote natural stuff. And there are many functional doctors who also struggled with eczema, rosacea, psoriasis, whom I've interviewed, who have admitted that they too chose to use steroid creams or have advised their patients to use them, but in very small dosages. So I think that it's unwise to just throw the baby out with the bathwater here. I mean, granted, I'm not a doctor, but I just want you to make the decision based off of your own values, as well as being, or at least feeling, as informed as you possibly can, so you can make the best decision for yourself. One that is safe, one that maybe you even have another conversation with your doctor about so that you can feel as informed as humanly possible. But as you go through the process, it is really important to keep in mind that on your journey, the more inflammation that stays in the skin increases the leakiness factor. It increases the filaggrin issue, where filaggrin is not being produced correctly, and that's what sort of helps us maintain that healthy skin barrier function. So you got to find your way through it. I don't have an exact answer for you. I can only hand you the information and allow you to hopefully make the best choice for yourself. If you have any other questions, feel free to leave them in the comment section for this podcast. And if you have a question on any issues about your skin, head on over to healthyskinshow.com, scroll down, and leave us a voicemail. We would love to include your question in an upcoming episode. All right, so with that said, let's dive into today's conversation with my friend, Dr. Izabella Wentz.
Hi, everyone. Today, I actually have this guest with me, and I've known her for quite some time, a number of years actually, and she was on my other podcast, and I'm very appreciative that she was willing to join us here because today we are going to talk about the connection between thyroid health and what's going on with your skin. And it's so important, but it's something that dermatologists don't oftentimes look at, consider, do any sort of workaround, and it's something that you do need to look at as far as a root cause approach if you are going to take that. And I think that's an important way to go, especially if you actually want to resolve symptoms, not just simply manage them. My guest today is Dr. Izabella Wentz. She's an internationally acclaimed thyroid specialist and licensed pharmacist who has dedicated her career to addressing the root causes of autoimmune thyroid disease after being diagnosed with Hashimoto's thyroiditis in 2009. Dr. Wentz is the author of the New York Times bestselling patient guide, Hashimoto's Thyroiditis, Lifestyle Interventions for Finding and Treating the Root Cause, and the recently released protocol-based book, Hashimoto's Protocol, a 90-day plan for reversing thyroid symptoms and getting your life back. And by the way, guys, I love that book. Actually, I love both books, but that one especially, and I do recommend it to clients. As a patient advocate, researcher, clinician, and educator, Dr. Wentz is committed to raising awareness on how to overcome autoimmune thyroid disease through the Thyroid Secret documentary series, the Hashimoto's Institute practitioner training, and her international consulting and speaking services offered to both patients and healthcare professionals. And you can find her and all of her work, which is fantastic, over at thyroidpharmacist.com. Thanks so much for joining us, Isabella. I appreciate it.
Thank you so much for having me, Jennifer. I love your work, and it's an honor to be here with you.
You know, it's funny. The skin issue tends to be very overlooked as far as its connection to thyroid issues. And one of the first questions I ask my clients is, do you have a thyroid problem? Have you had your thyroid checked? And they typically say no. So can you tell us a little bit, for anybody who's listening, why would your thyroid play a role in how your skin, the health of your skin?
So our thyroid gland is our master metabolism gland, and what it does is it stimulates our heat production and how we break down energy. And what's happening, whether the thyroid is underactive or overactive, is going to have an impact on just about every single cell in the body and how quickly these cells turn over. One of the big things that we see with thyroid disease and skin issues is slower skin turnover. So our skin is just not having that beautiful baby glow anymore because it's just not renewing itself as frequently as it should be. And so we're going to have dull skin, dry skin, more wrinkles. And a lot of my clients and readers will say that they have premature aging as a symptom of their thyroid condition. Now, those aren't the only symptoms related to thyroid disease that can manifest on the skin. Some other things that I've seen are going to be an orangish tint to the skin. This could be because thyroid hormone helps us break down vitamin A. And if we don't break that down properly, then we can get that nice, like carrot-like tint to our skin. People will say they have gray skin or pale skin. This is going to be a lot of times due to us not utilizing our nutrients properly because of thyroid disease and some of its consequences. So we might have some type of anemia. We might have a less elasticity in the skin. And this is going to be related to, again, some of the nutrient malabsorption issues that are related to thyroid disease. Then we're going to have co-occurring issues like rosacea, vitiligo, eczema. These are going to be common in people with thyroid disease, more common than in the general population. In fact, when I was preparing for our talk today, I looked up a statistic that was in the back of my head. 97% of people with vitiligo actually have some sort of thyroid abnormality. 97%. If that wasn't enough, we also have cystic acne. That can be a part of it. Any kind of acne can be a part of thyroid disease. A lot of times my clients will say, okay, this is not fair. I've got thyroid disease. I've got this dry old skin, and I also have acne like I did when I was a teenager. What's going on? And then another common issue that I see is going to be chronic hives. So chronic urticaria. This is very much a common issue with thyroid disease and was one of my first symptoms that I had and something that I spent a lot of time investigating and getting to the underlying causes and triggers of that.
And just curious for you, as far as the hives piece, it's a really interesting and frustrating topic for a lot of people. And they end up taking a lot of Benadryl and other antihistamines, trying desperately to get them to stop. Is there some reason that you found that is connected to the hives that might drive it aside from just food? Because I know a lot of people, they've taken out strawberries and all sorts of stuff, and still they have no idea why the hives are coming on.
Absolutely. So research shows that taking thyroid hormone medications actually can suppress the chronic hives. So people with subclinical thyroid issues and even people with normal thyroid hormone levels, when they test positive for thyroid antibodies, this can cause that hive-like skin reaction, potentially due to the breakdown of thyroid cells. So low dose of thyroid hormone can help with that. Going deeper and kind of going into the one layer deeper, I always like to look at the root cause. There's actually a parasite, not to scare anybody, but it's a protozoal parasite known as Blastocystis hominis. It's tiny, tiny, tiny. You can't see it with the naked eye. It can be the underlying root cause for Hashimoto's, for chronic hives, as well as irritable bowel syndrome. So if you have those three symptoms, treating that parasite, if you're positive for it, can help you get rid of the hives right away, the IBS, and in some cases, if the thyroid disease is not advanced enough, it can help you get rid of the thyroid condition. One of the really great things that you and I both are fans of is the probiotic Saccharomyces Boulardii. Just taking that for 30 days, some studies have shown can eradicate this potential parasitic pathogen.
That's great. That's actually good to know for people that are listening, and hopefully it doesn't scare them too much, as you said. But, in talking about this, I'm thinking about the listener and where their head's going to be right now and what their education is. And they're probably thinking, wait, thyroid dysfunction. What does that exactly entail? Because Hashimoto's, for example, is a low thyroid state in which there are autoantibodies presented in the body. We can test for that. And then there's also more like Graves' disease where it's overactive thyroid. Does it matter what type of thyroid dysfunction and, that may result in symptoms?
Typically, we have the two spectrums of thyroid disease, and some experts will argue that they're the same condition, right? And that it's just different parts of the thyroid anatomy that are affected. So in one case, you might have too much thyroid hormone production. In another case, you might have not enough. And this is kind of the end result of what's going on. Really, we used to think that people with hypothyroidism had this set of symptoms and people with an overactive thyroid had this set of symptoms. When in reality, there's a lot of overlap back and forth. So we'll see, for example, a person with thyroid disease underactive thyroid was thought to have more of like a depressive and slowed mental state where they were sluggish and depressed and cold. And then you had a person with an overactive thyroid that was hyperactive and they had difficulty concentrating or anxious, where what we see now is a lot of times these things overlap. So you might be anxious and depressed. You might be cold intolerant and you might be heat intolerant. So really, I like to think of thyroid disease as a spectrum where we might have fluctuating symptoms of too much thyroid hormone and not enough thyroid hormone.
So on that point, because I think this is important, there are different thyroid markers that you can test for. So you're talking about thyroid hormone, but could you break that down a little bit for us? Because I know that there's inactive forms and active forms, and there's other pieces to that feedback loop. But what should a listener who's now going, wait, I got to get my thyroid checked, what should I even be asking for? What would you tell them?
So if you just go to your doctor and say, I want my thyroid checked, they'll just run one test called the TSH test. This is a fabulous test for very advanced cases of thyroid disease. For the first 10, 15 years that you might have it, that test might be perfectly normal. And so you might have undiscovered thyroid disease. What you want to ask for are going to be thyroid antibodies. These are going to be TSH receptor antibodies, thyroid peroxidase antibodies, and thyroglobulin antibodies are the three most common ones I request to be tested. And just to back up a sec, those will tell us if the immune system has started to recognize as our thyroid gland as a foreign invader and started attacking the thyroid gland, which is the cause of 90% plus causes of thyroid disease in the United States. And then the other things to look for are going to be thyroid hormones. So the levels of actual hormones that we have in the body that are available to interact with our receptors. These are going to be free T3 and free T4. And these test for two of the main physiologically active thyroid hormones we have in our bodies.
All right, so here's the question then, leads me to this. They're going to go, but my doctor just ran like total T4. Isn't that enough?
I think it's a great start, but if we want to uncover thyroid conditions, there could be a lot of different abnormalities. So there could be just an abnormality in the total T4. But chances are, if you just do that, you're not going to catch the other types of issues that you might have, such as elevated antibodies, low T3, or low free levels of thyroid hormone. And so we really want to look at that full comprehensive thyroid panel.
That's great. And I know too, you've got some great resources on your website that I'll definitely link to, because I think it'd be great for people to be able to see what those tests are. That way they know exactly what to ask for. And I'll put that in the show notes for the listeners, because if you're new to this and that's a surprise, this comes as a surprise to you for whatever type of skin issue you have that's been chronic, getting your thyroid checked is a piece to this puzzle. So a lot of people love to kind of get into the kitchen and try different things. And I know with different skin issues, there can be different food triggers, not all the time for people, but for some people there can be. And food can also impact your thyroid. And one of the cool things, you've got this like great cookbook coming out that I am so excited about. And it's honestly beautiful, by the way. It is a beautiful book, which I've had the pleasure of looking over. So think about it, guys, is this way. Like, you can't go directly to the skin all the time. Sometimes you have to go through another facet or piece of the body or a piece of the puzzle in order to support the skin. So in this case, if your thyroid is off, how are we going to support the thyroid? And can we help do that with, I know you mentioned medication, but can we do that with food?
Absolutely. And with food, using food as medicine, or food pharmacology, as I like to call it, we think about which foods are not working for us. So we're thinking about which foods we need to eliminate. And gluten, dairy, and soy are some of the ones that are most commonly going to be reactive for most people in the Western world, because those are the foods we're commonly eating, right? And then the other thing we think about is what type of things can we add? And I really like adding really nutrient dense foods into our repertoire. Sometimes it's a lot easier to say like, these are the things to add into your day rather than saying like, oh, I can't have this, I can't have that. Two foods that I really love for people with thyroid conditions as well as skin conditions are going to be green smoothies as well as bone broth. So with green smoothies, people will say, 82% of my readers, I did this extensive survey a few years back, said these smoothies gave them more energy. 60% said they had better mood. 40% noticed benefits in weight. People are also recognize that their skin becomes more elastic and more bright, and they just look more fresh and renewed when they incorporate green smoothies into the mix. And so the reason why this works is they give us this nutritious food without all the digestive stress. So people with thyroid conditions and skin conditions may have trouble breaking down foods, and this food kind of just sits there, and we're using up all this energy and resources to try to digest it without getting all of its yummy benefits. When we take in smoothies, we get all these nutrients pre-digested, and so they're able to nourish our bodies, get that protein into our bodies that helps to restore our skin as well as our thyroid and our immune system. And the other thing is the bone broth. So this has healing collagen and nutrients that support our gut lining and skin. We see 70% of people with thyroid disease will say they started bone broth, it was super helpful for them. 62% saw an increase in energy, 57% improvement in mood. And then about a third of people noticed right away that they had an improvement in skin. So those wrinkles become less prominent. The skin looks younger. It's more elastic. This is an excellent beverage that can be sipped on throughout the day. And I've got like a super easy, 3-minute recipe. You set it up and you walk away.
Cool.
In my cookbook.
That's great. And this is going to be available for sale soon. I imagine you could probably go pre-order it on Amazon. And everybody, I'm going to go put a link to it. It's the Hashimoto's Food Pharmacology Cookbook. It's beautiful. Like I said, it is a beautiful resource. And I highly recommend adding it to your library because it's just loaded with incredibly nutrient-dense food. And if you haven't started making that shift yet away from more conventional processed foods and you're thinking there's not a connection to your health, there is, even for your skin. And collagen is an excellent nutrient, by the way, for the skin. So I have one other thing before I know you've got a great gift for everybody. I have one more question, and I think this is an important question, which is why I want to ask it. So people are thinking, okay, I could support my skin via the thyroid with some healthy food and cleaning up my diet, but if there is true thyroid dysfunction or significant irregularities in thyroid levels, can you do it just through food, or may you need some thyroid support, medication support to actually make some improvements?
I would say both can be true depending on the person. So for some people, I see they get off of gluten within 3 months, their thyroid function completely normalizes without any thyroid hormone. Or I've had people with H. pylori infection that can cause thyroid disease. They get rid of that infection and their thyroid function normalizes. And these are success stories that we like to utilize. And, as clinicians, we can showcase and say, this was just one little trigger that we took away. But for most people, it's a lot more complicated. And if they have long-standing damage to their thyroid gland, it's so much easier to prevent this damage than it is to regenerate a gland. Not saying it's not possible. It's just saying it's not easy. So for a lot of people, they may benefit from some hormones. And I'm a pharmacist. My training is in using medications appropriately. And when you don't make enough thyroid hormone, using thyroid hormone medications can be especially helpful. I do talk about making sure that you are on the right medication for you. This may not be Synthroid for everybody. Maybe Synthroid for you, maybe Synthroid for your aunt, but it might not be Synthroid for your cousin. There's various types of thyroid hormone medications. Some of them are naturally derived medications, and a lot of people do better on those than some of the synthetic ones.
Yeah, well, thank you for that, because I want to have an honest conversation about what is out there, and I don't necessarily think that all medication is bad. But this is right, and this is one instance where sometimes the medication can be very helpful, and people think, I'm just not going to do that. I don't want to be on any medication. But with your thyroid, I feel like if you need that to support good health, there's not really anything to replace it.
I always say don't martyr yourself for a cause, right? So like, let's use every tool that we have out there to get ourselves better. I once consulted with somebody that said, I'm not willing to change my diet. I don't want to take medications and I don't want to take any supplements and I don't want to do any testing. Can you help me? And I was like,
no, not really.
I'm at a loss here though, like maybe try some deep breathing, but you really have to take action and you really should do things that are out there that can help you if they're available to you.
I agree. And as a thank you for everybody tuning in, Isabella created this beautiful resource for you guys to kind of dip your toes into her latest book. And you can check this out at thyroidpharmacist.com/yummy. Everybody, those are yummy recipes. And you can go over there. I'll put the link in the show notes, so it's super easy for you to find. But you're going to get the first chapter of the Hashimoto's food pharmacology, as well as the sneak peek recipe booklet that will include some great recipes that you can try right now. But thank you so much, Isabella. I really appreciate your time and your passion for helping people figure this out, because the thyroid piece is so significant. It affects so many women. 1 in 8 women, at least. That was the stat that I was aware of for a number of years. It may be even more than that. We don't know. And I'm so appreciative of all the work that you've done and how you have shone a light on this issue and empowered women and men to take back their health and become their own best advocates. So thank you so much for joining us.
Thank you so much for having me. And it's really my pleasure and my life's work to help people take charge of their own health. So hopefully this was helpful.
Absolutely. And remember, everybody, go to thyroidpharmacist.com. Great website. And like I said, I'll put all the links in the show notes for you.
If you didn't know about the connection between your thyroid and your skin, now consider yourself to be informed. I also have a really great article over on Skinterrupt as well about this issue to help expand upon what we've discussed today with Dr. Wentz. I will post that in the show notes so that you can also take a look at that information. There's so much more that we can talk about as far as the thyroid and the way in which it's involved in skin health, but I think this is a great place to stop. So with that said, I just want to take a moment again. Thank you guys so much for being this amazing, powerful community as we join together our voices and demand better care, demand more options so that we can make fully informed decisions. And it's my hope that everything we do together in creating this community, we will enact change that will ripple across the globe so that hopefully everyone everywhere, when they end up with chronic skin rashes, they will have more options and they will know about more options. It's so cool, and I'm so glad that we're doing this together. I just want to thank you so much. If you haven't had a chance yet, please go and rate and review the podcast on whatever your favorite podcasting platform may be. And I look forward to seeing you in the next episode.